keeping an eye on imaging. Discussion and commentary based on articles from JACC, Cardiovascular Imaging.
Hello, my name is Dr. Vaskan Dilsizian. I'm Associate Editor of JACC Imaging. With me in the studio is Dr. Eva Thomas from Sweden, who has written a very important paper in the current issue, reintroducing, if you will, exercise MAGA in the pre-op evaluation of patients with severe aortic regurgitation. Dr. Thomas, welcome.
Thank you.
Perhaps you can first tell us the resurgence of exercise MAGA, and why do you think this approach would be important to the current approaches of looking at resting echo, resting LV function?
Why a cardiac surgeon is interested in exercise MAGA is the timing of the operation for patients with chronic AR, because we know definitely when it is too late and the patient has ventricular dysfunction, but we want to find a point of no return, if you like that, to find the perfect timing to preserve the ventricular function and prolong the time for the patient without left ventricular dysfunction.
Great. If my recollection is correct, all the previous studies with exercise MAGAs or RNA were in patients who were symptomatic with severe AR. Is your patient population different, and would you recommend this in patients with asymptomatic severe aortic regurgitation?
According to the guidelines, patients with asymptomatic AR could and might be operated. Symptoms are a definite indication for operation, but the previous studies are done during an era when indication was symptoms of AR. That's why we thought that it would be nice and interesting to have a look at the patient population when patients are asymptomatic.
Okay, so could you summarize your findings in 29 patients, if I'm remembering correctly?
We had 29 patients. The majority were asymptomatic, and we did MAGA before and after surgery. And during exercise, the patients showed different kind of reactions on the exercise. And we could find 3 different groups. One group decreased in EF during exercise. One was flat, unchanged. And the third group had a normal reaction during exercise.
And were those are preoperative responses? How did they turn out after successful valve replacement afterwards?
All the replacements were successful with no complications, and these patient groups showed the same reaction. Those who had normal reactions preoperatively presented a normal reaction after the operation, but those who had abnormal reactions had abnormal reactions after surgery as well.
So you would have hoped that you would have predicted the myopathic process earlier so that surgery would improve it after. In this case, what you're finding with exercise MAGAs, if you will, that the myopathic process has already occurred, and despite valve replacement, you are no longer able to recover that function. Would that be fair?
Exactly. We didn't improve the patients with the surgery.
And so moving forward in your laboratory, in your program, if you will, how are you going to be utilizing exercise MAGA in screening your patients as well as perhaps following them after valve replacement?
We plan to introduce a MAGA, exercise MAGA, as part of our screening to find the patient population which still have normal reaction but shows other signs of ventricular dysfunction, which could help us to find a better time point for surgery.
Would there be any LV dysfunction where you would not operate on the patient? Would there be any? Would you use this data in any way to say, well, it is a point of no return, and therefore there would not be any? Would you have the data on that, or maybe it's too early? to say that?
It's too early to say such things, but my guess would be, if I'm allowed to say such thing, is that for those patients who already have myocardial dysfunction or myopathy, is still a help, because you stop a progress.
Great, Dr. Thomas, it's been a real pleasure having you here. We look forward to having your subsequent paper, which as we discussed, is to look at the outcome of these patients on a long-term follow-up, and hopefully you'll come back and talk about that.
Thank you very much.
You're welcome.
Keeping an eye on imaging.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.